They're working as an healthcare assistant in an hospital, in the domiciliary sector, in the nursing home, in the care home, wherever you find yourself. Yeah, my question is, what next after this scenario, after this job position that you have just gained, or you're already in the UK already, and you're already working as an healthcare assistant in the hospital, wherever you are? What is your next step? Are you working towards becoming a nurse, a midwife, working in the community as a qualified, a professional person in this sector? I think you should take a step. You don't need to wait. Oh, I'm just new. I've just spent a month. I'm just 3 months in the country. No, I've just been doing the job. No, this is not my dream job. I am just using it to while away the time. Why waiting for my dream job? Yeah, I understand. Anyway, whatever you want to do, please do it on time, because time waits for no one, and you don't know what can happen in the next future. You understand? The job or the sector might become so competitive that to survive in it might be so difficult. Nobody knows. I'm not saying that's gonna be, but nobody knows. I think whatever is worth doing is worth doing well. If you are in the UK as an healthcare assistant, working in any sector, I think it's high time you start thinking of what you're gonna be in the next 1, 2, 3 years. If you have decided that, oh, you want to progress in this career, you want to move up the ladder, I think it's time you start making some moves, asking questions, making some researches on the internet. Ask your colleagues, ask your manager, ask anybody on how to progress. You can talk to your manager, you can talk to your supervisor, you can Google it, go on internet and say, what can you do? What can you do? How can you progress from being an healthcare assistant to another position? If you work in the health sector, you know the sector is so broad. You can decide not to be a nurse. You can decide to be a specialist in any field, be a dialysis nurse, be a dietitian, be a speech and language therapist, be a diabetes nurse, tissue viability nurse. The field is so wide. I've said it in many of my videos in the past regarding this health sector. If you haven't gotten some qualifications, try to do some online, speak to your manager about some courses that you want to do to build yourself, to develop yourself in this career. Start with the functional skills maths and English, or if you have your GCSE, your O level, yeah, that might also help. I wouldn't know what they're going to require in this country for career progression. There are many apprenticeship routes in which you can use. There are nursing associate program in which you can do to progress on this ladder. Okay, you just have to talk to your manager. If you work in the care home, speak to your manager. Okay, this is what I want to do. This is what I intend doing. How can you support me? They should be able to say, okay, fine, if you want to do this, you have to start with this. Because I know that after securing a role as an healthcare assistant, support worker, the first thing course you have to do is a care certificate training. Then some will support you to do your NVQ2, level 2, health and social care. Some will ask you to do the functional skills, maths and English, just to have it. Some will also even proceed and say, oh, do you want to do NVQ3 in health sector since you're in this field? So if they haven't suggested that to you, I think you should speak to your manager, your supervisor, based on wherever you work, and tell them that, okay, I want to do my functional skills, maths and English. They should be able to support you, tell you how to go about that. Ask them if you want to do health and social care level 2. Ask them if you want to do NVQ3 if you have gotten level 2 health and social care. Even in some cases, you might not even need the health and social care level 3. Like in the NHS, if you want to, as an healthcare assistant, if you want to go ahead to do your nursing associate program. This nursing associate program is to qualify you to be a band 4 nurse, not a qualified nurse this time around. Yes, you are going to be a registered nursing associate. You are allowed, based on your qualification, to perform all clinical roles that qualified nurses do. The only thing you are not permitted, or your job role does not permit, is to give IV medication. But your qualification allows you to perform other clinical roles, just like how nurses do. But you are on a band 4, while a registered nurse is on a band 5, and you also have your PIN. So if you work in the NHS, you just depending on the trust. Anyway, some trusts will say if you have worked in the trust for like 1 year and you've got your master in English, then and they do a lot of interviews to say that yes, you can really study at that higher level, because nursing associate course is on a level 5 qualification, you understand. So they're gonna put you through after this, after assessment. Then the most trusts are always in partnership with many universities, depending on your borough, depending on the state you live. But the thing is, if you don't ask, there's why you cannot. So when you tell them that you want to do a nursing associate and you've gotten this qualification, you've worked in the NHS as for 1 year, you have your master in English, functional skills master in English, then they're going to support you to go for your nursing associate. It is a 2 years course. Okay, then you become a registered nursing associate. You have the RNA badge and you have your PIN from the NMC, which is a Nursing and Midwifery Council, okay, to practice. Then you begin your journey, and as time goes on, then you'll be seconded or supported again to go for your, all these are on apprenticeship level. You don't need to pay a dime, you understand. So then afterwards, maybe like a year or something, then you can approach them again if you are still willing, if you want to progress to do an apprenticeship, like another 1 year course to become a registered nurse. Okay, that is if you want to go through the nursing associate route. And that if you feel like, okay, I've gotten my functional skills master in English, I've gotten my level 2 health and social care or NVQ3 in health and social care, then you think, okay, you are good to study at level 6 at an higher degree rate. Then you can like talk to your manager or whoever is your coordinator and tell them that you want to go for you would like the trust. That's why we are talking in the NHS right now. You would like the trust to like fund your program to do your apprenticeship in to become a registered nurse. Then they're going to look at the circumstance, they're going to look at the funding, and they're going to talk to the school, to the university, because they're always in partnership with the university. So any university that they partner with or that you have like make inquiries about, and they are taking that course or they are offering that course, then your trust is going to like look at it. Okay, they can sponsor you to do your apprenticeship while you work as well and you study and you still get paid. You still get your salary at the end of the day. Then it's going to be like a 3 years to 4 years course depending on the university. Okay, and before you know it, you're already a qualified nurse. If you don't want to be a nurse, you can decide to go into other field, become a midwife, become what's it called, a physiotherapist, occupational therapist, different tissue viability nurse, diabetes nurse, different route, be in the radiography section. You can decide to go for the learning and disability, become a learning and disability nurse, become a mental nurse, different route, different means of progressing in this field. Okay, and if you work in a care home as well, approach your supervisor, your care coordinator, care manager, and tell them these are your aspirations. And like, trust me, I'm sure they're going to support you if they know that you have all the qualifications. You already have a platform or a foundation that they can also build on, and you've got a good reputation. They like your work. They like the way you contribute. They like the way you support your client, the service user, the patient. They're going to assist you to do this. And if you work in the domiciliary sector as well, you can also speak to them as well. But if you think that they do your company, the organization you work with, does not have all these means to support you, then you have to do the work by making inquiries, trying to build yourself. You can do some online courses to become a registered nurse if that's what you want to do. There are courses in Open University. There are some online courses in which you can do to become a qualified become a registered nurse. And if you want to deviate to other health sector, working with the ambulatory department in the radiography section, there are many rounds. The thing is, you can't just it's only if you don't ask, you don't get it. You don't get those information except you ask it. So the essence of this video is to let you know that we just have to keep moving, keep asking, keep making efforts to get better. And if you think that no, this is not what I want to do, I'm just here for the meantime, I'm still looking for a better job, a dream job, yeah, that is okay. But you don't need to waste time when you know that this is not where you are going to. Keep up doing whatever you're doing. I know you might have been making some effort to get to your dream job like that. Just keep up, keep it up, keep doing it. You never can tell. You don't know if that next application is going to be the end result to all your labor. You understand? So I would advise you that Rome was not built in a day. We have to keep trying, keep pushing, keep making efforts, and you're gonna get there. So I would just advise you not to give up, take up that course, take up that role, do some apprenticeship program, do some trainings. You wouldn't know when luck is going to smile at you. And before you know it, you'll be like, wow, thank God I take this step. Thank God I'm doing this. And that will be good news at the end of the day. All right, now, that will be all for today. If you like my content, if my content suits you, please subscribe to my YouTube channel. Follow me on all my social media handles. Comment in the comment section. Share my content to people. Let it get out to everybody. Okay, I remain to be Oba Wilson, and I will see you in my next video. Cheers and bye.